Ontario and New York's music station, Yes FM. Mr. Probs Waves, 838. Cloudy, we're at 30 or minus 1 this morning. Michelle and Michelle are here today because we're talking about a lung screening. How does this work? What do you have to do? Michelle.
I'm Michelle Catlin. I'm the Community Outreach Coordinator at Claxton Hepburn.
Yeah.
November is Lung Month, and it marks the also one-year anniversary for our lung cancer screening program. And we just want to remind the public that we're still doing it. It's only $99. If you were to pay for this out of your pocket at the regular cost, it'd be over $3,000.
Wow.
Most insurance companies don't pay for it right now because it's a screening. So we just want to really remind the public that we're still doing it, and we try to keep it as affordable as possible. And we've had some really, really great outcomes, and I'll have Michelle Kamar to talk to you about that.
What type of person, Michelle, needs to have this screening done? Is there like a criteria you're looking for?
We follow a particular criteria. The individuals that want to have it done calls Michelle Catlin's office. Michelle screens them, and if at any point we are in question if a patient can have this done, she forwards it to me. I review the information. I then call the person, talk to them at length to see if we can get them in one way or another.
Okay.
There is particular criteria. Criteria consists of what they've been exposed to in the environment. Secondhand smoke is definitely out there. The second thing is if they have a history of any form of cancer, if they have any pulmonary disease already that's on board. A lot of COPD, as people know it as chronic obstructive pulmonary disease.
Okay.
And if they've worked with chemicals, asbestos, coal mines, been around wood stoves, things like that, we take that into consideration.
Not experiencing problems today, you've just had exposure to something in the past that may lead to problems down the road.
Yes, and the thing is lung screening is just as important as breast screening. Lung screening is done due to the fact that we don't pick up cancers in the lung until they're progressed to a stage, what we call a stage 3 or stage 4, where the outcome is not very good. So with a lung screening, consists of a low dose exposure to radiation. They go in a tube. They have it done, doesn't take very long. The radiology group at Claxton Hepburn are wonderful individuals. So what they do is they talk to the person while they're having it done. The test results come back. Dr. G reads. I inform the patients. We have excellent communication with providers in the community. And we see if they have any diseases. Now, we look for lung screening.
Yeah.
Lung cancer, but we found many other disease processes on board.
Are there symptoms you're experiencing that may lead you to want to do this?
Well, if you smoke, have a chronic cough, if you have been around secondhand smoke, if you have a history of cancer in your family.
Right. Especially lung cancer in your family.
Absolutely.
From smokers or even non-smokers in the past, you should at least look into this.
Yes. 15% of individuals that develop lung cancer are usually exposed to secondhand smoke or occupational exposure where they've worked.
Okay, if we want to have the screening done to find out more information, how does this work? What do you have to do?
They should call my office at 713-5251.
Okay.
And we just wanted to let everybody know that we've done about 100, and out of that 100, only 10 came back normal.
Wow. Okay. All right. So definitely, if you have exposure to chemicals at work, you've been exposed to secondhand smoke over time, history of cancer in your family, you have pulmonary issues, or you're a smoker or a recently, become non-smoker, you should have the screening done. And the number again, Michelle?
713-5251.
Okay. Thanks for coming in today, Michelle's.
Thank you. Happy holiday.
842 Macklemore, Ryan Lewis, Yes FM.